Case number 10, surgical specimen of a liver explant. So you had no specific clinical data. That was on purpose because you have to guess what was the disease of the patient from the appearance of the liver. So now let's take a look at the slide from this liver explant. You have a large piece of parenchyma, and usually when you are looking at the cirrhosis, the main issue is trying to find some clues about what was the underlying, or what is the underlying liver disease. So here the cirrhosis is quite obvious at low magnification with all these cirrhotic nodules, and you see that they are demarcated by fibrotic bands. Now let's take a closer look at the fibrosis and the fibrotic bands. So you have here some structure, an artery, vein, you have some inflammatory infiltrate, mainly lymphocytes, maybe some polynuclears, also macrophages, and also some plasmocytes. Again, one artery. We'll take a look at other fibrotic bands. Here we have the vein, maybe here the artery. Again, let's check other fibrous bands, artery, the vein, and so on. So they all look the same. Here again, the artery, the vein, and so far the appearance is not really specific, but what is important is not what is on the slide, it is what is not on the slide, because I don't know if you noticed, but we never saw a bile duct. And we have to see sometimes in the fibrotic bands some bile ducts, because in the fibrotic bands there used to be portal tracts. So I know it's difficult sometimes in cirrhosis to assess the existence of bile ducts, but you must see sometimes when you are looking at a cirrhotic liver, you must identify some bile ducts in the fibrotic bands. And here there is a complete vanishing of bile ducts. So that was for the fibrotic bands, and let's take a look at the hepatocyte nodules. You can see that they look regenerative. You have some thick trabeculae, and you have also cholestasis. Here, canalicular cholestasis. Also here, here, here. Really nice pictures of canalicular cholestasis. And you have also probably some macrophages that have taken some bile. So we can guess what was the underlying liver disease when we are looking at these slides, and it was primary sclerosing cholangitis. But I'd like to remind you that actually you can make the difference between primary sclerosing cholangitis, the disease, and a secondary sclerosing cholangitis, for example, due to chronic lithiasis in the bile ducts. And here on this, maybe this former portal tract, you can see this fibrous tissue here, and maybe we can guess that it was a bile duct that vanished, and there is a fibrous scar. So here, to summarize, you have fibrosis, cirrhosis, with a complete disappearance of all bile ducts, and it is highly suggestive of sclerosing cholangitis, either primary secondary.